You're listening to Docs Outside the Box, episode 54, with Dr. Camille Hammond, CEO of the Tininia Cade Foundation.
Welcome to Docs Outside the Box podcast. This is your official show, looking inside the minds of cutting-edge and innovative doctors. Think you'll find these stories in any medical textbook? Sorry, you're getting real life insight from men and women pushing the envelope beyond medicine. Ordinary doctors doing extraordinary things. Let's start now with your host, Dr. Nee Darko.
This episode is brought to you by Set for Life Insurance. Protect yourself against life setbacks with Set for Life Insurance. Set for Life Insurance gets you disability and life insurance at a reduced cost with their exclusive discounts. Now that's why I use them. Visit www.setforlifeinsurance.com and tell them Dr. Darko sent you. What's good, everyone? This is Dr. Nee Darko. Thank you again for coming back for another episode of Docs Outside the Box. Promise that this one is going to be a really good one. So on this episode, before we get into our guest, I want to read off some statistics that I think will be really shocking. So check this out. 7.4 million women between the ages of 15 and 44 have used infertility services in the United States. That's literally 12% of the population. Here's another one. 40% of infertility cases can be traced back to the male partner. Here's another one. Only 30% of IVF cycles produce a live birth. And the average cost of a single cycle of IVF in the United States is $12,000. That's actually lower than what I thought it would be. And those are some very sobering statistics. They really bring light to the whole prevalence of infertility in the United States. It's a problem that even affected me. It affected my wife and I earlier in our marriage. We went through 3 rounds of unsuccessful IVF treatments. And I'm going to tell you right now, I'm going to be really open and honest with you. It was a lot of dough. And thank goodness for locums. Thank goodness for the ability to do extra work outside of what I normally do. And without that, I mean, literally, we would have had to take out loans. We would have had to use credit cards. And because of that, because we were able to do locums, in essence, we were able to be a financial means to take care of this situation without having too much of a financial burden put on us. But for the majority of the United States, the majority of couples within the United States who are having this situation, that's not the case, right? Treatment oftentimes can be really cost prohibitive. Lack of knowledge leads to people not seeking treatment. And listen, we're not even talking about the stigma that people have with being infertile or having or suffering through infertility. So my next guest is Dr. Camille Hammond, and she formed the Tininia Cade Foundation. And family by family, baby by baby, literally she is doing her best to provide support as well as financial assistance to help infertile, needy families overcome infertility. So the Cade Foundation to date has provided over 70 families with financial support for both adoption as well as fertility treatment nationwide. Now, you may be wondering, what's up with the name? Why is it named Tininia Cade Foundation when, the CEO is Dr. Camille Hammond? Well, organization is named after Dr. Camille Hammond's mother, Tinina Cade, who, guess what? Seriously, at the age of 55, and at the time she was the oldest person to do this, at the age of 55, she delivered triplets for Camille and her husband, who themselves at the time were suffering through years of infertility. So this is literally a podcast that is jam-packed with tons of really good information. So on this episode, you're going to learn the prevalence of infertility. You're going to learn about the stigma that women feel with infertility. And you're going to learn about her, quote unquote, outside the box story of overcoming infertility. Learn about how pursuing her passion allows her to give back. And of course, as with all my other guests, you're going to learn how she answers #I'm not just a doc. Yo, on the real, this episode should have came out months ago, but because of technical difficulties and just getting caught up with so many different things, it took a while before this episode has come out. But you know what? In perfect action, this episode is out. I want you all to please share this episode with someone who you know is going through this process, someone who's going through this struggle. Please share it through Instagram, Facebook, Twitter. This is something that we need to shed more light onto. So without further ado, I present Dr. Camille Hammond. Welcome back to another episode of Docs Outside the Box. I am really excited to bring to you my next guest. My next guest is Dr. Camille Hammond. She is CEO of the Cade Foundation. It's a foundation that was started in 2005 that has provided support to families that have issues with infertility. The actual full name of the foundation is actually the Tininia Cade Foundation, which is named after Dr. Hammond's mother, Tinina Cade, who delivered triplets for their family back in 2000. Am I correct? 2004?
Yes.
Back in 2004. So before we get too much into the interview, Dr. Hammond, welcome to the show.
Thank you so much for having me. I'm excited to be a part of this, and I'm looking forward to sharing about my experience and hopefully encouraging a few people to step outside of the box.
Oh, yeah. I'm real excited to have you on the show. Your story is compelling. You literally are a national celebrity.
I don't know about that.
Well, I mean, you've been in Jet Magazine, The View. You've been in ABC. I mean, you've been in so many different news outlets. But I really am excited to have you on the show. I want to learn more about the foundation. The audience wants to learn more about the foundation and how, like you said, you are stepping outside the box. So before we get started, get too far in depth with things, can you tell us a little bit about yourself, like where you're from, what medical school you went to, and so forth?
Absolutely. So I got to give credit to my undergraduate as well. I'm a proud Spider, University of Richmond Spider. And then I went to the University of Maryland School of Medicine for medical school.
Okay.
Johns Hopkins for my residency and my master's in public health.
Okay.
And my my fellowship was in cancer survivorship at the National Cancer Institute.
Okay.
And before leaving, I guess, a clinical career, I was a program director at the University of Maryland School of Medicine, and I worked in cancer survivorship.
Can you explain, I haven't heard that before, but just for the rest of our audience, can you explain exactly what a fellowship in cancer survivorship, what a practicing physician in cancer survivorship actually does?
So my work was more research-based, looking at outcomes, and I've always had an interest in fertility because of my own personal struggle with fertility. So looking at fertility-related outcomes in people that struggle with different types of cancer, whether they were childhood survivors, or looking at outcomes for people who struggle with cancer as children, as well as people who struggle with different types of cancer as adults.
Wow. So you actually were doing research with fertility, but in cancer patients.
Exactly.
And it just so happened that kind of led you down the path of you having your own issues with fertility.
Well, it was the opposite way. So I was diagnosed with endometriosis the first week of college. I was rushed to the hospital with heavy bleeding, and they ended up doing a laparoscopy, and long story short, was diagnosed with stage 4 endometriosis as a freshman in college. And so I always had an interest in fertility because I was told from that point on, as soon as you meet Mr. Right and you're ready, you don't need to delay childbearing because it may be hard for you to get pregnant because you have this endometriosis. So, that was the fertility thread ran throughout my I would say academic career. I always kind of had an interest in that.
Okay. And you also mentioned that you've alluded to that you've stepped away from clinical medicine. So now you are 100% full-time running the Cade Foundation?
Absolutely. So in 2007, I was still working at the School of Medicine. My husband is an orthopedic surgeon, and we had kind of gone back to our life, our pre-baby life, even though we spent years and years, waiting for, praying for, working towards having these babies. But we were still in training and fresh out of training. And so we were putting in those heavy hours, those long hours. And one day I came home and one of my kids, I think it was one of my sons, called my nanny Mommy. And
are you serious?
Well, that was really bad because, kids don't lie. They tell you what they think.
Right.
Mommy is the one who kisses the boo-boos, who's there when they cry, not the chick who shows up after they're put down for bed and is missing when they wake up in the morning. So
Who's paying for stuff, though?
yeah, you can, but,
Yeah.
there's a cost,
Mhm.
and you've got to be willing to, you got to look at how much is it worth. So
Right.
anyway, he called my nanny mommy, and she responded. She said yes. And I just thought, okay, something is just wrong here. And from that moment, I started to plan with my husband about leaving the clinical side of my career because, we just went through too much to become parents, to have our kids lost because neither of us were present. They're not a trophy. It wasn't like we went through all that just to say that we had kids. We wanted to be the one that was so into their lives and to be able to speak truth to them, not to have this other woman who, there's nothing wrong with her, but those weren't her kids.
Right.
And so I stepped away from my my clinical career and started running the foundation full time. And the blessing was within, I would say, about 2 months of me stepping away, my husband got an increase in his pay. And it was the exact amount that I had left behind when I came home, but I really came home. And then shortly thereafter, started running the foundation full time from my home.
So when one door closes, another one opened up. Did you, during that time when you were starting to think about stepping away from practicing medicine, did you have any other options as to what you wanted to do, or you knew you were going to take time off, spend more time with your family, and then also run the foundation, or did you have any other ideas in mind?
When I first left, all my thoughts were focused on getting home so that I could be an engaged parent and not gone before they really woke up and coming home when they were already so tired that there was no meaningful interaction. I wanted to be mommy, not just that lady who pays for stuff. And so it was after I got home and I started thinking, okay, what else am I? Like, I love being mommy, but I also have all of this training, these experiences that I think, can be useful, and I can continue to serve perhaps in a different way. And so that's when I thought, okay, I can, Jason and I started this nonprofit a couple years ago. It was very, very part-time. It was not really intended to be something that we continued to pour into year after year. We wanted to raise $10,000 to help one family, and then, would feel like, okay, we have paid it forward. We were blessed and we were a blessing, and now we're square. But we already had this, the framework was there, and I thought, well, perhaps I can use some of the skills and some of the passion that I have for this field and grow this into something, of course, with God's blessing, that can be more of a resource in the infertile community.
You haven't looked back since, because now I'm looking at your website. Your organization has grown tremendously, board of directors. I'm looking at the numerous couples and families that you've helped through this process of infertility. That's really amazing.
We've been blessed, and it really has been a great, for me, I love what I do. So I would do this even if I didn't get paid. And I don't really get paid a lot. So, that's not too much of a stretch, but I still love what I do. And I think that if you can find something that you would do, even if you didn't get paid doing it, then that's the area you need to pursue, because the money will come. Like I share with you, even though I stepped away from a career where I was making academic doctor money, as soon as I left, the money still came. It was just, in my husband's paycheck instead of coming to me personally. So our household actually didn't suffer at all. We grew as a household after I left. And I feel like in some ways that's probably because I was walking more in my purpose, what I should have been doing. in the first place.
That's a really great. I appreciate you sharing that, actually. So, do you feel like this is your calling? Do you feel like this is your passion?
I absolutely feel like this is my passion. I have a love for families that struggle with infertility. I remember how I felt all those years where
Can you tell us more about that? Is that okay to ask if you can give us
absolutely,
more details about your struggles with this situation?
absolutely. Yeah. My husband and I got married. We met the first week of medical school, and it was, fairy tale, love at first sight. And 3 years later, we got married and started trying to get pregnant immediately because I had been diagnosed with endometriosis as a first year college student. And I remember so many times going into places, hearing friends and family members complain. They were taking birth control pills. I had some family members that were super fertile and they kept on popping out babies and really were not pleased with that. They didn't want to continue to have babies, but people would make these jokes, and they were funny if you didn't struggle with infertility. They were
Right.
really hurtful if you were the one who was doing everything possible, everything in your power, to become a mommy and to grow your family, and that wasn't happening.
It's like
So,
a silent struggle almost.
we felt very alone. I remember going and fake laughing at some of these comments because I didn't want people to know and I didn't want to stand out. And then like excusing myself to cry. I did that many times. I didn't know any Black people, or even any brown people, frankly. I didn't know and I didn't know of any people who looked like me who struggle with infertility. There was this myth. I think it came out, it was popularized in the early 90s, late 80s, that Black people were super fertile. You had these quote unquote welfare moms on TV that had, 10 kids, and, that the narrative was all Black women are super fertile like these women. And the narrative was a lie, first of all. Infertility affects about 10% of all groups. It doesn't discriminate. But because I didn't know anybody who admitted that they struggled with infertility, I really did think it was my issue. Like somehow there was something wrong with me personally.
Obviously, you went through. Or actually, how about this? How did you come to terms with knowing that you were going to need assistance? How did that go?
Well, my husband and I were in the medical field. And so we at least had some baseline of knowledge about infertility being a medical condition, number one, not a moral issue, because, there are some communities of color, many communities of color, that believe somehow that when you have infertility, you've done something to cause yourself to be infertile, whether it's something moral that you've done, kind of like a scarlet letter, God is punishing you, whether you've done something sexual and, you kind of earn this by being promiscuous, or something like that. And we don't do that to other medical conditions. We don't do that to diabetes or high blood pressure or many other conditions that are very prevalent, but somehow we did that. But because my husband and I were both physicians, we knew, well, it is medical. So we didn't have that bias, but we still had we don't know anybody and we don't have family who's acknowledged that they struggled with infertility. But just kind of going off of our desire to be parents. And at one point it was just all consuming. It was, when I'm in the grocery store, if I see another pregnant woman at the counter, I'm going to scream. Like, I'm avoiding family functions. I'm not going around my friends, who are having kids. And it was just something that was very important to me and to my husband at that time. And so we just decided we didn't care. We wanted to pursue this and we wanted to have a child of our own.
So when you went to, so you obviously you did multiple rounds of IVF, they were unsuccessful. What happened next?
So after our 6th round that went to transfer, and there were actually 8 rounds, there were just 6 that we had enough eggs where we could, they could
6 rounds?
Yeah, so
wow.
6 that went to transfer. There were 2 that I didn't have enough mature eggs where they even went to transfer, because that, you got to remember, this is like 15 years ago when we started, 15, 16 years ago when we started. And they wouldn't even take you to transfer if you didn't have a good number of fertilized eggs, a good number of embryos that, looked like they would implant. They wouldn't just take you to transfer. They would say, okay, let's do another cycle. Things are different now because, they're only recommending that you put one embryo back now, or at least many clinics are. But this was a completely different age in the fertility world, where I was going through treatment. So I had 6 cycles that went to the transfer stage. And after the last one, our doctor, who I think was really cared about us, he knew that we were broke. We were young physicians, but we didn't have any money, and we had run out of insurance. And he said, this is, unfortunately, I think you guys need to go in a different direction. He didn't say he thought that we wouldn't be great parents, but he did say, I know you don't have any more money to keep doing this. And, if you continue doing the same thing, in all likelihood, you're going to have the same result. I.e., if you continue having IVF, it's not likely that you're going to get pregnant. And what we found out later was I had endometriosis and adenomyosis. So the lining of my uterus was completely eaten up anyway, which is why I had a hard time with the baby, growing roots, implanting.
Implantation.
Mm-hmm. Yes, exactly. So anyway, he suggested that we consider adoption or a gestational carrier. And so, we hadn't really shared with most people that we had infertility, but we had talked with my parents and with my husband's parents about it. And my mom and dad, after that doctor's appointment, of course, we were devastated. And I shared with my mom and dad, this is what the doctor says. He says we probably shouldn't do it again. We need to think about doing something different. And my dad said, well, I saw this program on 60 Minutes back when you were 18 about this woman who carried her daughter's baby because the daughter wasn't able to get pregnant. You think that's something your mom could do? And, my mom was really excited about that. Of course, my husband and I were young doctors. We didn't know everything. And we just kind of thanked them and said, no, we're good. But thankfully, my parents didn't give up. They were extremely persistent. And they really kind of kept coming back at us and saying, hey, we need to think about this. Let's look into this.
I mean, that's amazing how they were more they believed more in that. Cause I could see myself in your shoes also, kind of just whatever. That would never work, or just not really putting much credence to what they're saying. But it's amazing that they kind of felt so strongly about that.
Oh, they were definitely more committed at the beginning than we were. My mom was 54 years old at the time. She was postmenopausal. And, I didn't know if it was possible, but I certainly didn't want to do anything that would potentially harm her. And so, but after a while of them just kind of continuing to bring it up and let's pray about it, let's talk about it, we decided to at least see if it was possible. And her doctors said that, first of all, it was possible, but they could not guarantee anything because of her age. They didn't think it would kill her, but, they really could not guarantee anything. And we we moved forward. Of course, my mom and dad were fully committed. And so, by this point, we were committed and we walked forward in faith. And she conceived my 3 babies. She was able to do something that I wasn't able to do, you know, in my 20s. And she's at this point 55 years old. So she delivered my babies at 32 weeks. They were all healthy. They were in the NICU for, one of them was there for a couple of days, and the other 2 were there for a few days after that, just to get the suck swallow coordinated. And we were just overwhelmed with gratitude, both to my family, my parents, the doctors, the nurses, everyone who had cried with us, prayed for us, supported us in any way. And when we brought our babies home, my husband and I made a commitment to one another that we would give back. We felt like God had just given us this huge blessing, and we wanted to give one family that same blessing. So we wanted to give them $10,000 to help out with the cost of either fertility treatment or adoption.
That's amazing.
Yeah. And so that's where Cade came from. It was named after my mother because we wanted to give symbolically what she had been a part of giving us, which was the gift of parenthood. But it has grown so much from that kind of whisper, that hope of a dream to give one family some financial support to. At this point, we've funded 70 families. Wow. With up to $10,000 each. We've hosted hundreds of education-focused conferences, just sharing, first of all, the good news that infertility doesn't mean you won't be a parent, and the great news that there are many, many different ways to become a parent despite a diagnosis of infertility.
Where do you see the organization in about 5-10 years?
Well, my hope was always to support as many families as possible. And what I started to see repeatedly was people coming to Cade after years and years of undiagnosed infertility. So people would come to Cade at 36 years old. And when you talk to them and you'd say, okay, do you have infertility? Well, and they would say, yes, we've been trying for about 8 to 10 months. Okay, so that is not the CDC's definition of infertility. That, I guess at 36 years old, that would be. But the definition is really 12 months of not getting pregnant after 12 months of unprotected sex. But then when you dig a little deeper and say, well, are you using contraception? Are you on the pill? Do you use condoms? Have you ever used anything? And then the question is no. We've been together for 10 years and we really never had to use anything. Then you realize people are thinking that their intention was known by their ovaries.
Right.
My ovaries know I'm not ready to become a mom, so they're just not working. No, honey, you've struggled with 10 years of infertility. And so then you think, let's dig a little deeper into that. Why is it that nobody has asked you if you are trying to get pregnant, and also are you doing anything to prevent pregnancy in this 10-year period? Because if somebody had asked that question, perhaps, there may have been something very basic that could have been done earlier to help you either understand what's going on or to conceive. And so while I want to continue our patient-focused, our family-focused Pathway to Parenthood conferences, but the last 2 years, we've also held these provider-focused Pathway to Parenthood conferences. We've held them at Hopkins for 2 years. We held one at University of Maryland School of Medicine last year, and we're holding another in February, where we work with these providers in training, these medical students, but mostly residents, fellows, and we put infertility on their radar so that when they're doing an H&P, they don't miss an opportunity to ask about people's, whether they're using contraception and their intentions, but also their behavior around fertility, so that they can intervene or refer for care earlier in the process. What we also see is a lot of times, even though infertility does not discriminate, so it occurs with the same prevalence across all of these different communities. People who are disadvantaged for whatever reason, whether that be because they are from they're a Black or brown person, whether they're poor, whether they live in an area that is geographically isolated. These people, even when you correct for some other factors like economics, like education, they still are not having the same outcomes as other groups. And some of that is because there's this delay in either referral for care, or whether it's referral by another doctor or self-referral. And so we want to make sure that the doctors are screening for and referring appropriately. But we also want to make sure that patients understand about infertility. We've done some work even on graduate student campuses, letting people know about infertility so that they can know and not be surprised if they show up at 36, 37 and, they don't get pregnant immediately. You need to know at 29, your fertility is going to start to go down pretty quickly after about 32 years old. So,
taking the covers off of something that people are kind of holding in secrecy, taking the taboo label off of it, absolutely, or at least making it not an issue when it becomes an issue.
Absolutely. It's just medical. Mm-hmm. And like any other disease, or you need to know what the causes are. You need to know kind of what to anticipate, and you need to know the different options for treatment.
I know that you do a lot of speaking, and part of what you're doing obviously is assisting families with financial support for infertility, but also there's another part where you're actually educating the public on infertility in general, and how we react to people who have infertility, or just our general thoughts and processes about it, so that it becomes more of a not so taboo subject. Can you talk about examples of you having to educate people, maybe even men, about this situation?
Absolutely. We have done some work just with men. We've done work just with men in the faith community. I recall doing one conference, the Black Family Conference at Hampton University a few years ago. And I gave this presentation just for a very general audience about infertility. And at the end, this elderly African-American man who was, dressed very well, stood up and I want to say gave a little critique. He said something to the effect of, I don't think that I'm doing anything wrong if I ask this question, when are you gonna start trying to get pregnant? Because I don't have my intention is not wrong. And I said, well, you're ignorant, because it is wrong. Your intention is irrelevant. And if you continue to ask this question because you were ignorant, now you don't have that excuse. I've already told you it's hurtful. And so you're just being malicious. So don't do that. And I think I embarrassed him a little bit, and the intention was not to embarrass him, but it was to drive home the point to everyone who sat in that packed out room. This is just simply not something that you can do. And even if it's not offensive to you, it's hurtful, potentially hurtful to that family that's struggling. So just don't do it.
And that's, I definitely see that as I'm getting older, as I'm trying to start a family. People ask that question all the time, and I can imagine it has to be a very hurtful thing. I'm a guy, so obviously it doesn't hit me as hard, but to a woman, particularly, women who are professional and are thinking about conceiving or having children at later stages of their life, this is something that is a constant issue, probably in the back of their minds, probably.
Well, it's an issue for women and men. I mean, there are many men who want to see that family hairline. You know, they want to see that Harris hairline, or they want to see those eyes, or that swirl that, you know, they have and daddy has and pop has and everybody and all the men in that family line have had that. They want to pass those things along and see that next generation. So I think that having families is something that, you know, most people want to do. Maybe men and women express that want in different ways, but I have certainly seen that it's an issue for both men and women. And I will add, for anyone listening that may not be aware, a third of the infertile cases are male factor. Okay, so it's not just.
I appreciate you qualifying that. Thank you for clarifying that.
1/3 are female factor. So male and female factor, the same percentage of cases. And then 1/3 are unknown factor. And that doesn't mean that it's not caused by something. That means that our technology is not advanced enough where we understand what it is. But things are moving very quickly. And so something that's diagnosed as unknown factor right now, 5 years ago, we may know that, you know, it's this hormone or it's this protein that is missing, and that's what's causing this family to deal with infertility.
Now, what was it like after your mother gave birth to your children? What was that like being in the national spotlight? Because I did a little bit of some some internet stalking, and saw that you were in Jet magazine, and your story was in Jet magazine and multiple stories, obviously in the Richmond area, and obviously national media outlets also. What was that like?
Well, you know, my husband and I were very deliberate in our decision to go public with our story, because we felt that, number one, people needed to see a face, a regular family that had infertility, so that they could understand they weren't alone in this. Because, you know, if a disease doesn't have a face, then you put your own face there and you feel like, well, there is something inherently wrong with me. But if you see other people that you can identify with, and you think they look normal, then you may say, well, they look normal and I got the same thing that they have. So maybe they're, you know, maybe I'm not inherently broken.
Right.
But we went forward, and we also didn't want anybody else telling our story and making things up, you know, and changing the narrative from our truth. So we told our story. But it did get to be a little overwhelming at times. You know, I did have media outlets calling. They were going through our employers. When our kids were born, we were still residents at Hopkins, and you know, there were a couple of media outlets that actually went through like the paging system at Hopkins to try.
Are you serious?
Yeah, it was kind of like, okay, this is what real celebrities have to deal with full time. I quit. So after we did that initial day or two of interviews, we actually didn't do any more interviews for 2 years. And everything that was published or that was produced was cannibalizing, you know, that 2 days of coverage, that 2 days of really day and a half of interviews. But then we did one with Essence magazine, because I thought it was really important in communities of color that other women of color understood that infertility is a universal, you know, it's a universal, it does not discriminate based on any factor, and that it wasn't just wealthy white women who struggle with infertility. And then we went on, you know, over the past couple of years to do interviews with a few select outlets that I felt would be able to help us tell our story in ways that were decent and respectful. But I'm really excited that over these past couple of years, the Cade Foundation has grown from just Jason and Camille's story of when Tinina carried their triplets to Kara and Troy's story, or Amanda and Jeffrey's story. You know, it's become all of these families who are connected with us, you know, by this threat of infertility, but who have overcome and who are in their community serving and giving back and encouraging. So and that's been beautiful to see it go and really blossom into all of our stories.
I'm going through your blog right now on your website, and obviously it's very diverse. I mean, there are people or women who are writing from various walks of life. So it really does underscore what you're saying, that infertility really doesn't discriminate.
It certainly does. And if you look at the group of families, this year we just gave out 8 grants in early November. One of the families was from Afghanistan. We had Muslim, we have Christian, we have Black. One was from one of our African American families was from Guam. We've got people from Pennsylvania. They're rural, they're urban, they're everything. And that is what infertility is, and that is what the community of overcomers is as well. We are everyone.
Wow. Now we're getting towards the end of our conversation, our interview. So I just want to ask you some quick, fast questions. Is that okay?
Yeah, sure.
Okay. The first question is, what's one thing you want listeners to get from this podcast?
That you can pursue your passion and still have a very fulfilling professional career. And even if you're doing something where you may not make as much money, if you're doing what you're supposed to do, the resources will come available. It will happen. Just you need to be faithful about your decision-making process and go where God tells you.
Love it. This is a tough one. What's one thing that you're proud of that nobody else knows about? Stumped you.
I'm proud that I get to walk my purpose every day. And people may think that I, am just doing this because it's something to do, but I really do care about this, and I have passion for this, and I would do it even if I didn't make a dime. I would do this even if I had to pay to do it.
Love it. Appreciate the honesty on that answer. Knowing what you know now, Dr. Camille Hammond, what advice would you have given yourself? Let's say you got a chance to meet your pre-self as a pre-med or even as a medical student. What advice would you have given yourself back then, knowing what you know now?
I would just say, keep going, girl. You're doing the right thing. I needed all of those experiences and that training to prepare me for what I do right now. I may not see patients in a clinical setting, but I still use those skills that you develop. And that knowledge, no one can take that away from you. And the beauty of knowledge is it can be applied in any number of settings. That ability to think critically, to trust and verify. I think that those are things that are very important. And I will say, I think it would be difficult for me to do the work that I'm doing right now and receive the level of acceptance and support from the physician community, as well as the larger community, if I weren't Dr. Camille.
Absolutely. Absolutely.
So that MD has made a huge difference.
Absolutely. Well, I want you to finish this sentence. It's a sentence that I present/ask to all of my guests. It's a statement that says, I'm not just a doc, and I asked them to finish it. Some of my guests have said world traveler. Some of my guests have said doctorpreneur. Some of my guests have said so many different things. So, Dr. Camille Hammond, I present to you, I'm not just a doc, I'm a
servant.
Dr. Hammond, I just want to say thank you very much for being on the show. I just want to take a short moment just to acknowledge you for what you're doing. And I think sometimes there are times when I acknowledge all of my guests, but I think sometimes there are times when acknowledging doesn't even do the proper service, because I think it's so obvious what you're doing is for the greater good of the community. The majority of my guests on the show have been physicians who are doing amazing, great things, stepping outside the box to assist other physicians to kind of find and get the careers that they always wanted. But you're a little bit different. You are doing something that's helping the greater public, the greater good. And ultimately you're providing hope to families that didn't think hope existed in that area. So I wanted to acknowledge you and your husband and your entire family, including your mother, for the amazing thing that you are doing, what you provide, the hope that you're providing to families. And I just wanted to say congratulations on what you're doing. I hope you guys continue what you're doing. And I want to acknowledge you all for the greater good that you're all doing. Thank you for being on this show. We've got to do it again.
Thank you so much. It's been a real great opportunity. And congratulations on pursuing your passion and helping other people understand that it's possible to step outside of the box and fly.
Once again, that was a really great interview, definitely bringing light to something that we don't talk about too often. If you want to learn more about Dr. Camille Hammond, as well as the organization, the Cade Foundation, please go to the website, www.cadefoundation.org. Once again, that's spelled CADE foundation.org. Looking forward to your comments. Make sure you share and make sure you let me know what's going on in the Docs Outside the Box Facebook group called Docs Outside the Box Nation. You can find more about that on the website docsotb.com. And I'm going to catch you guys on the next one. Just remember one thing, though. We only got one life. Let's make it count and live outside the box. Peace.